So one of the biggest misconceptions that we hear about fibromyalgia is that no one knows what causes it. And if there is no known cause, then of course, there is no known cure for it, right? So that means that all we can really do is manage symptoms, and that usually means that you use a combination of drugs that are supposed to control or help pain and the other symptoms associated with fibromyalgia, right? Now the problem is that these drugs don't really work all that well, and they come with an enormous risk of side effects. And some of these side effects are the same symptoms, or the same as the symptoms of fibromyalgia. For example, pain and fatigue. That's right, some of these drugs, some of these FDA-approved drugs will cause pain and fatigue, and those aren't even their worst side effects. So why is it that there are many people who have been diagnosed with fibromyalgia who have gotten themselves completely out of pain and chronic fatigue, and who live healthy and happy lives? Why is that? Well, it turns out we actually know a lot more about fibromyalgia and how the body works than you may have been led to believe. And after working with thousands of patients and consulting with numerous other practitioners from different parts of the world and all over the country, we've been able to put together a method to not only understand fibromyalgia, but to also guide our patients through it in order to give them their lives back. And we've broken this down into several pretty easy to follow phases, which has worked for our patients time and time again. So let's have a look at it, and let's widen our understanding of fibromyalgia. So let's get into the first phase. That's biofilms and lymphatics. Now, our first major players with fibromyalgia are always biofilms in the lymphatic system. So you're going to ask yourself, what are these and what does that mean? Well, biofilms are nothing more than collections of pathogenic bacteria or other microorganisms that adhere themselves to surfaces inside the body. It's a mouthful. Basically, these pathogens cover themselves in mucus in order to protect themselves from your immune system or even from medications that you may have taken to kill this infection. So let's take a look at the sinuses as an example. Let's say you develop a sinus infection. You have maybe a lot of pain in your sinuses, a lot of yellow or green mucus, maybe a sore throat, maybe a headache, or even a fever, right? So you go to your doctor and you are given some antibiotics to kill this infection. And the antibiotics do their job extremely well. The infection starts to go away fairly quickly, but you notice that maybe you still have a little bit of mucus left in your sinuses. And maybe your head even feels a little heavy from the mucus, but maybe your fever is gone, the sore throat is gone, the infection itself seems like it's better. So, of course, you're happy with this result, right? Then several months later, maybe you still have some of that remaining mucus there. You've had a little bit of chronic sinus congestion ever since. And then suddenly it starts to get worse again. And before you know it, you've got another sinus infection. So what gives? What's causing this? So as it turns out, some of these bacteria actually decided to hide themselves in this mucus so that your immune system, or rather the inflammation and the fever that you got, which is your immune system attempting to rid your body of this pathogen, which is threatening you, so they've hidden themselves from your immune system, and they've hidden themselves from these antibiotics so that they wouldn't die, so that they couldn't be killed. They've covered themselves in this mucus. So they just sat there hibernating inside your sinuses, waiting until there was a good time for them to come out and strike again, to proliferate. And this can happen especially when you're more tired or more stressed, because stress and fatigue can both temporarily impair your immune system. And if that doesn't paint a clear enough picture for you, take a look at the plaque on your teeth. That's another good example of a biofilm. And we all know what happens if you don't brush your teeth. You get things like gum disease, like gingivitis, which will destroy your teeth. You get cavities. You can have your gums destroyed by these. So this is just one more example of a biofilm, but these biofilms can be found just about anywhere inside your body, including your digestive tract, your lungs, even your brain. So when we start talking about flare-ups of fibromyalgia, we now know that one of the major causes of flare-ups are these biofilms, or rather the hibernating pathogens found within these biofilms. So I mentioned biofilms now. We also talked about lymphatics. So what are lymphatics? The lymphatic system is a waste elimination system within your body. It exists all over your body, and even your brain has its own lymphatic system, what is known as the glymphatic system, which is meant to clear wastes from your brain. Well, something that is very common and almost characteristic in fibromyalgia is that the lymphatic system becomes burdened and often leads to chronic lymphatic swelling. People might notice this as swelling, or they might actually be aware of that it's specifically lymphatic swelling. Now additionally, all these metabolic and microbial wastes that your lymphatic system is supposed to be getting rid of, but now because it's overburdened, all these wastes start to make their way into the connective tissue around your muscles and joints, which leads to muscular sensitivity, which is one of the characteristic signs of fibromyalgia. This is where these tender points will come from that maybe you've been tested with at the doctor. Now what's even worse, all of this stagnant toxic fluid being carried around in the body's lymphatic system makes for a perfect breeding ground for pathogenic microorganisms like bacteria and fungi. And then of course, these can in turn cause flare-ups, infection, and of course more biofilms. And carrying all of this extra waste in your brain just further aggravates the problems like fatigue or even the ever-popular fibrofog. You know, the troubles with memory and focus and basically difficulty in doing every task because your brain is overwhelmed with metabolic wastes. So we always work with this phase first. We utilize a combination of plant-based medicines that are designed to aid the body in breaking down biofilms and supporting the immune system and improving lymphatic flow. And we also use something that we call gasotransmitter therapy. Basically, we teach our clients how to regulate their own body systems to enable them to combat pain, fatigue, and infection naturally by themselves. Because then these are tools that you can take for the rest of your life, or use for the rest of your life. So that brings us to phase 2. Phase 2 is gut dysbiosis. So what is gut dysbiosis? Honestly, it's one of my favorite topics. So your digestive tract is home to trillions of bacteria, and you heard that right, trillions with a T. Some of these are good, meaning that we share a symbiotic relationship with them. That means that we help each other to survive. But some of these bacteria are not so good, and they can cause harm if they are left unchecked. So in a state of dysbiosis, there is an imbalance between these good and bad gut bacteria. When your gut is in a state of dysbiosis, it can give birth to or even aggravate just about any health problem you can possibly imagine, from troubles with maintaining a healthy weight to emotional problems, chronic pain, and even major autoimmune diseases. So how does this impact fibromyalgia? Well, in fibromyalgia, there is almost always an issue of gut dysbiosis. This happens from a variety of places. The most notable of which is the use of antibiotic drugs, as we mentioned in phase 1. You see, antibiotics, even though they are a life-saving medical intervention, can cause significant damage to the digestive system, especially when they are used too frequently or even just too many times without adequately restoring the function of the gut. So the antibiotics have the ability to wipe out a large portion of the bacteria, both good and bad, from the gut. Now additionally, this process causes both inflammation and damage to the lining of the intestines. Now, when this lining gets damaged, it causes us to have an increase in intestinal permeability. That means that more food particles find their way into your bloodstream. This condition is often referred to as leaky gut syndrome. And it's not just antibiotics that will cause this problem. Frequent use of NSAID drugs such as acetaminophen or ibuprofen are also found to contribute to this problem. Further, having a bad diet, especially for a prolonged period of time, will also cause problems of the gut, just like this, or problems of gut dysbiosis. I actually had a patient 10 years ago who was diagnosed with fibromyalgia, and when I asked her what her diet was like, she told me that all she ate every day for 2 years was candy bars and soda. Now you can imagine what that does to the gut over time. So let's look at how this is a problem. Now, when there is a leaky gut like this, more food particles and even metabolic and microbial wastes found in the intestines will find their way into your bloodstream. Now your body has a very sophisticated methods of removing these wastes or toxins from the blood. The liver, first and foremost, has this job of helping to remove these waste products. But the problem is, the liver can only handle so much work. And if you are also taking other drugs, either prescription, over-the-counter, or recreational, chances are your liver already has its plate full with everything else that it's doing. So since the liver cannot fully deal with all these metabolic and microbial wastes, the burden starts to fall on the lymphatic system, like we mentioned before in phase 1. And this causes increased swelling in the lymphatic system and then leads to the problems as I've mentioned before. And as you know, this in turn can lead to pain, sensitivity, brain fog, fatigue, and the numerous other problems. Now, to make matters worse, this gut dysbiosis problem leads to problems with the emotional state. You see, some of the most important neurotransmitters like serotonin and dopamine are primarily made in your gut. And if the gut is in a state of disease, it becomes more difficult for the body to produce and utilize these hormones. And then these neurotransmitters are extremely important. They are responsible for helping us to feel healthy and happy. They are responsible for promoting a sense of well-being and how we deal with stress. So you can see why gut dysbiosis can even promote problems with the mind, such as anxiety, stress, and depression. So when we get into treating this stage, diet naturally becomes even more important. The medicines we begin to use have to be gentle and powerful in order to start reversing the damage done from years of this abuse. So that brings us into stage 3, cortisol and nitric oxide dysregulation in the body. Okay, so since I've already gotten into how the mind gets affected, let's take an even deeper dive as to how the stress response contributes to and maybe even causing some aspects of fibromyalgia. So now, I've heard many people, fibromyalgia sufferers and medical professionals alike, who claim that fibromyalgia comes from emotional trauma. And this is certainly one of the big contributing factors. You see, emotional upheaval is actually a major cause of pain, inflammation, and even destruction of our nerves. And this isn't just in fibromyalgia. Now, we've all heard of this stress hormone called cortisol. And when we get chronically stressed, this causes dysregulation of cortisol, which in turn begins to influence our mental state and also our ability to sleep properly. In fact, insomnia is one of the major problems associated with elevated cortisol. Now, as the cortisol levels stay elevated, it places an increasing burden on the liver to be able to catabolize or break down cortisol. Now, if you are already in a state of chronic pain and taking numerous drugs and you already have a problem with gut dysbiosis, the liver is probably already being burdened plenty. So now the normal cortisol dump, which is normally supposed to wake us up naturally in the morning, it occurs in the middle of the night. A lot of people will say usually around 2 or 3 a.m. is when they're waking up. So when we'll hear this, I'll frequently hear my patients complaining of how they can't sleep at night. They wake around 2 or 3 in the morning and they feel completely wide awake. Of course, your body via cortisol just told you it's time to wake up. It's told you it's time to be awake and aware and ready for the day. So the problem here then is that you lose sleep. Now, that loss of sleep contributes to more fatigue, of course, and also to an increase in inflammation. Now, this fatigue, this loss of sleep and inflammation further causes stress levels to rise up, which in turn perpetuates this problem with cortisol. It basically becomes this nasty repeating cycle that feels like it's almost impossible to break. Now, if that's not enough, when you are chronically stressed, your body increases something called nitric oxide. Now, nitric oxide is an incredibly important gasotransmitter which is involved for numerous processes throughout the entire body. It's an incredibly important thing to us. However, when nitric oxide is not properly regulated and when you get too much of it, it can be highly destructive. The research has actually shown that elevated nitric oxide actually starts to break down the nerves. And this causes a very characteristic burning type nerve pain, very commonly found in fibromyalgia. Now, if that's not enough, if this excessive nitric oxide collects in the muscles, it leads to muscular contraction, which can make you feel tight and sore and stiff, and may even cause headaches. Now, all of these are extremely common aspects of fibromyalgia, as we know. Plus, your blood vessels are also made out of muscle, and if they contract, it can decrease circulation and cause your hands and feet to get very, very cold because of the lack of blood flow to them. One of the ways we commonly see this is through a disease phenomenon known as Raynaud's phenomenon. It's a condition where the blood vessels in the hands and feet contract, leading to the fingers and toes becoming freezing cold and maybe even starting to look purple or white. It's very uncomfortable. Now, I know this sounds like a lot, but along with this chronic stress response, we can also get chronic spells of fight, flight, or freeze response from all of this stress. Because all of this stress has degraded the nervous system. It's made us hyperreactive, and when we're hyperreactive, we start to become fearful, and that instigates this fight or flight response. And it's a very important natural reaction for the body to go through. It may even save your life in a life-threatening situation. Now, what happens is you have some kind of perceived threat that makes your fear response begin. Now, it could be a bear. It could be that a bear is trying to attack you. It could be someone trying to rob you or mug you. It could be almost falling off a cliff. Or in the modern day world, it simply might mean that you have a stressful meeting at work. So this fight, flight, or freeze response is basically causing adrenaline to course through your body. And it causes blood to go away from the digestive system and increases blood flow into your muscles. And this is literally telling your body to run like crazy or fight your way out of the situation. Now, in our modern lifestyle, such as in a work meeting, neither of these reactions is conducive to keeping your job or running a business appropriately, right? But these hormones like adrenaline and noradrenaline are still there, telling your muscles to fire, telling your heart rate to increase. So this will cause the muscles to tense up even more. Now imagine you are sitting at a desk for work and you get this response. Your whole body may tense up without you even realizing it. Now, when you finally do get up out of your chair, your legs, your back, your arms, your neck may all feel stiff from this response, which you may or may not even realize was happening. You know, you get out of your chair and you're just, you're not moving that well, right? Now, this then becomes an increasingly bad issue the more you age. You see, when your legs and your feet become more tense and stiff like this, it makes your whole body move differently. Now, instead of all these muscles in your feet and your legs and your back moving normally and absorbing the impact of simple tasks such as walking, your muscles don't move well, and the impact of each step is absorbed now by your joints, from your ankles to your knees to your hips and all the way up your spine. Now, this is one of the reasons we move so poorly as we age, and it is one of the big reasons why we develop such problems as arthritis. You see, all this impact starts going into the joints, goes into your knees instead of your muscles absorbing it, and that hits your cartilage. It starts to deteriorate cartilage. It starts to cause inflammation and, of course, pain. And it makes you not move as well, which causes further joint damage. So when we get into the treatment phase here, in stage 3 or in phase 3, we can still utilize plant-based medicines to calm the stress response and scavenge for these excessive pockets of nitric oxide. We even use the gasotransmitter therapy to aid in regulating these effects on the body. But also at this point, we begin to working with the mind and how we react to and perceive stressors. Obviously, we cannot completely remove stress from our lives, but we can alter how our body, we can alter our thought processes to better tolerate stress and to keep it from causing such damaging effects on our lives. Now, that brings us to phase 4. This is prostaglandin dysregulation and platelet adhesions. Wow, big mouthful, okay? It sounds like a mouthful, doesn't it? But really, in this phase, the primary issue we're looking at is circulation in the body. Very, very important. Now, in the previous 3 stages, we have already addressed a lot of huge factors that already contribute to poor circulation. So now in this phase, we are basically cleaning up any remaining issues that didn't get affected in the previous 3 stages. So in this stage, one of the primary problems we see is basically blood that is too thick or sticky. And one of the main issues here is what we call platelet adhesion. Now, these platelets are little particles inside the blood that are responsible for stopping us from continuing to bleed when we have an injury. And pains that are associated with this are often found at places where ligaments or tendons attach to bones. Now, sometimes these pains are even mistaken for joint pains. Now, these areas of ligaments and tendons are already not well vascularized. That means that they don't get a good blood supply already as it is. Sort of like how your muscles or organs might have a much more rich blood supply. So when circulation becomes impaired, these areas can suffer very easily. This can especially be the case if there are former injuries to these areas or if there's been prior surgery. Now, when we have an injury or surgery, we tend to develop scar tissue in that area, and it can cause problems with getting blood flow to these tissues. Something we notice very often is that this type of pain is often worse first thing in the morning. Now, why would that be? Well, when you are sleeping or basically immobile for a long period of time, it causes an increase in platelet adhesion. Basically, the blood becomes thicker and stickier, and it cannot nourish these tissues as easily. So the types of pain that often come from this particular phase are pains that are worse in the morning and may be characterized by a lot of stiffness. These pains can also present as chronic and stubborn and fixed pains, or pains that are sharp or stabbing in nature. So costochondritis, very common in fibromyalgia again, often falls under this category. Now, what makes this stage even worse is that you would think that something like exercise, which increases circulation, should make these issues feel better. Unfortunately, this may not always be the case. Now remember, how I mentioned these pains may be worse with old scar tissue. Well, when you have these areas where the blood flow is no longer optimal, the body tends to collect free radicals, which are small inflammatory molecules. So when you suddenly increase circulation to this area, these free radicals mobilize and can actually cause a temporary increase in pain and inflammation. So when we get into the treatment phase of this stage, we utilize plant-based medicines that actually regulate prostaglandins and platelets and act as anti-inflammatories in quite a variety of ways. These are also further aiding in regulating nitric oxide. In fact, these types of medicinals act in such an efficient variety of ways that it would take 3 to 4 different drugs to get the same effect. So that begs the question, why not just use these types of medicinals right away in the first phase? Well, it sounds like a nice idea, right? But it could be a very bad one. You see, when you improve circulation in this way, it is important to make sure that the rest of the body is working well, especially the immune system. Now, remember, those biofilms and hidden pathogens I talked about in phase 1, if we decided to jump straight into phase 4 and increase circulation before we dealt with these pathogens, it would be like allowing these pathogens to just invade the rest of the body without any resistance. This is why it is so important to keep these phases in the proper order, so that the body can heal and adjust in the right ways so that it remains healthy and gets healthy enough to eliminate the chronic pain and fatigue once and for all. So with those 4 phases, have we covered everything? Actually, no. We do have another 4 phases that get into some deeper processes in the body, such as how our cellular mitochondria work. These are where our cells produce our actual energy. There are also problems that can occur with things like anemia, or the hypothalamic pituitary and adrenal and thyroid axis, and the ways that the body produces our own endogenous corticosteroids, or our own natural mechanisms for fighting inflammation. But as it turns out, when you truly address the first 4 phases, that's enough for the vast majority of those suffering from fibromyalgia. Now, once those first 4 phases are taken care of, the body starts working better altogether, and these symptoms such as pain, fatigue, brain fog, digestive problems, etc., they just start to go away on their own. Now, I hope this video does shed some light on what is really going on with fibromyalgia.